in team. So we are very lucky to have Susan Birch today, who is a PhD here at the university, and she's going to talk today about support before the pill, the Family Planning Association, 1945, 1955. Susan is examining in her research the Family Planning Association after the Second World War in Birmingham and also here in Winchester. And as well as exploring support for the pill, the research addresses the work of women in delivering family planning assistance in the two cities, in Birmingham and in Winchester. And prior to being a student here at Winchester, she read for a degree in history at the University of Birmingham, and then she did a master in history at the University of Worcester. So very welcome, Susan.
Thank you.
We are going, as usual, to have your talk, then we have a question and answer session.
Great,
So
thank you.
if you can just, let's go to the here and a slideshow, and you can start from the beginning. There you are. So, most welcome.
Do I just move it like
Yes, you have a mouse here, or you can go there as you like.
Okay, that's brilliant.
Here or there.
Okay. Well, thank you very much, everybody, for coming, and thank you for the people online for coming to listen to me on what's quite a dark kind of afternoon. So thank you for coming to listen to me. As Gracia was saying, I'm going to be having a look today at support before the pill and the Family Planning Association, 1945 to 1955. And this talk incorporates quite a lot of my research into family planning in the post-war period, but also the women that offered that support in Birmingham and Winchester. Alongside my PhD, I'm currently undertaking a placement at the Wellcome Library in London, and I'm having a look at different medical organisations. So I'm looking at the National Birthday Trust Fund, which was a medical organisation for women, and I'm comparing it to the Family Planning Association. It's been a wonderful placement to see how women's organisations ran, and also having a look at the kind of support that was available in the post-war period. So thank you very much. So just to start, what I've done is I've divided up the presentation into three parts. The first part is the introduction, so 1945 to 55, and why particularly I've focused on this time period. So I'll have a look at, there's been quite a lot of research on the interwar period and quite a lot of research on the 1960s. So why particularly I'm interested in this time period. The second part looks at support before the pill. So the type of family planning support, and this didn't just include birth control. This also included infertility support for couples, which I'll be using as a case study, and having a look at a person called Margaret Jackson, who was involved in the family planning in Exeter, and how her ideas influenced the national organisation of the Family Planning Association. But also in the third part, I look at how some of these ideas actually came down into local family planning support in Birmingham and Winchester. So that's just an overview of what I'll be looking at today. So as an introduction, as I said, I'm going to be looking at research looking at family planning in the interwar period. And there's been a lot of research on the interwar period for a number of reasons, particularly because a lot of the family planning clinics were created in the interwar period, which I'll show you in a few slides' time. But there's also been a lot of research on prominent people involved in family planning. So I've put an image here of Marie Stopes, who's, I would say, is the most sort of famous person associated with family planning. She actually helped open the first birth control clinic in 1921 in London. And in 1918, she wrote A Married Love, which was one of the first books to openly discuss birth control. And actually, it's how I got into my research in family planning. My great-grandmother had a book of Married Love, which she'd covered over, tried to hide that she actually owned it. And when we were clearing out her stuff, we actually found it. And I was just really interested in it, how she involved, because she'd made notes in it and things. And I was just interested why, that she owned it, but also why she'd hidden it from her family. She'd actually tried to pretend she was reading Robinson Crusoe instead of a book on family planning. So I thought it was a really interesting bit, and it's how I got involved in it. But quite a lot of researchers have been interested in Marie Stopes. So I've got an image here of an event that happened at the Wellcome in London in 2022, and that was looking at Marie Stopes and her influence in eugenics, feminism and birth control. So there's a lot of researchers there. So I just wanted to show you that her influence, as well as the interwar period, has been quite widely researched. Just to give a bit of an overview, just for people about eugenics, just in case people wanted to learn a bit more. The term eugenics means well-born, and it was coined by Francis Galton in 1883. Francis Galton was Charles Darwin's cousin, so a lot of the ideas were influenced from that. Galton strove to improve the human race by engineering human heredity. And the Eugenics Society was founded in 1907 as the Eugenics Education Society. And I've just put a picture here on the right-hand side of the Eugenics Society trying to promote their work at conferences, which they did quite a lot. But I do touch briefly on eugenics in my thesis. But what I find the most interesting is that the Family Planning Association ran, as I'll explain, as a voluntary organisation until 1974, when it became part of the National Health Service. So during this time period, it had to run as a voluntary organisation. And so it relied on like donations and support from leading people. And the Eugenics Society had a lot of money. And so it was that they relied on the Eugenics Society to fund a lot of their work. And what I found quite interesting is it's quite evident in my research that there's a lot of friction between the two societies over what they wanted. And so I've just wanted to just point that though it's not a heavily part of my research, the Eugenics Society does come into a lot of their work, and also particularly in Winchester, as I'll show you like later, who could actually access family planning support. So going back to Marie Stopes and eugenics, Marie Stopes was heavily involved in the eugenic cause, as were a lot of people in family planning. So when she established the birth control clinic in London, which I mentioned earlier, she stated it would be epoch-making for our race. And in her third book, Radiant Motherhood, which I've put here on the right-hand side, she took that further and she wrote, "A baby's right to be wanted is of a racial importance." And her work has really been looked at by a lot of researchers. So Jane Carey in 2012 wrote an article on racial imperatives, where she looked at this relationship between eugenics and family planning, and also the role of prominent individuals such as Marie Stopes. So there's been quite a lot of research on that. There's also, as I mentioned earlier, a lot of research on the interwar period, because this was when the family planning clinics, a lot of them were being created. For example, and I've put an image here of a PhD thesis that I've included in my literature review for my thesis, called by Claire Langhamer on grassroots feminism, and it examines the creation of clinics from 1924 to 1938, and the two clinics I focus on in Birmingham and Winchester were both created during that time period. Claire Langhamer in her article also examines the role of leading people such as Marie Stopes that I mentioned earlier, but also other members such as Mary Stocks, who's quite a famous person in family planning. She was also involved in women's suffrage movement and the welfare state. So she's involved in a lot of different areas as well. But Claire Langhamer's thesis uses particular case studies like my research, and she looks at Stockport, Glasgow, Manchester and Liverpool. She looks at a wide range of different family planning clinics. The other period there's been quite a lot of is the 1960s. And I've put an image here of Hera Cook's book, The Long Sexual Revolution. And although you can tell by the title, The Long Sexual Revolution, she's actually looking at it from 1800 to 1975, so quite a long period. She really focuses on the significance of the contraceptive pill in the 1960s. And for this, she uses a range of sources, such as newspapers, but she takes a very national sort of overview. So she's looking at it and nationally as an approach, whereas my research looks at the case studies of local support, so Birmingham and Winchester. And in contrast to Cook, which is a key book that I'm looking at by Simon Schrader and Kate Fisher, Sex Before the Sexual Revolution, this really emphasizes the importance of sexuality pre the sexual revolution, so 1918 to 1963. And they found that a lot of modern methods of contraception were used in conjunction with a traditional method, such as abstinence. So really challenging this idea of the pill being as groundbreaking as Cook claims. And my own research really builds on Schrader's and Fisher's influential work. Their work contrasts two different parts of the country, so Blackburn and Hertfordshire from the 30s to 1963, so two very different locations. And my research explores the support in Birmingham and Winchester. But the major difference, though I'm looking at the same sort of time period and using case studies, I look at it through the Family Planning Association, which is an organisation. They're actually using oral interviews, which I chose not to do. So there is some difference, but it has been quite a key text for my thesis. So as I mentioned, my research focuses on the Family Planning Association, which is an organisation to help couples make well-informed choices regarding sex and contraception. And this is one of the reasons I'm really having a look at the time period there were a lot of changes that were happening just pre the Second World War, during the Second World War, and that really impacted on the period I'm researching. So before May 1939, the organisation, the Family Planning Association, was called the National Birth Control Association. And Audrey Leathard, the key text, The Fight for Family Planning, suggests this was to narrow the promotion of birth control to the less controversial family planning. So this emphasis on birth spacing by appliance or non-appliance methods rather than just a focus on birth control. So you can see there's quite a change between the two. And the objectives of the Family Planning Association also changed in 1939. So I put these on the board so you can really see them. They stated their work was to advocate and promote the provision of support for scientific contraception so that married people may space or limit their families, that idea of spacing, and thus mitigate the evils of ill health and poverty. So being aware of the social and economic issues that are happening and why people might be wanting to limit their families. They also wanted to establish women's health centres, so family planning clinics, where in addition to contraceptive advice, treatment and advice could be obtained for involuntary sterility, so infertility, minor gynecological ailments and marriage difficulties. So when I read this, I was quite surprised what they're actually promoting in the late 1930s. So as I said, it's not just an emphasis on kind of birth control. They're really trying to promote different work that they're doing, particularly in the sort of time period that I'm researching. As you may have noticed in the previous slide, this idea of married people, and this is one of the changes that happens during the time period that I'm researching. So yeah, primarily just before my kind of time period, it was mainly support for married couples, but there were changes during the post-war period. So by 1952, so still in the time period I'm researching, 1945 to 55, the Family Planning Association recommended that all pre-marriage patients should be welcome. So this idea of actually getting engaged couples to access family planning. Prior to 1952, this had really varied among clinics. So some clinics had really supported engaged couples gaining advice. Other clinics hadn't. So the Family Planning Association by 1952 is really promoting that they help engage couples. And I've got an image here from the welcome. Hopefully you should be able to see that. And it's something that I found last week when I was in London. And it's basically a promotion really leaflet promoting their work. So you should be able to see, hopefully you should be able to see some of the work that they're trying to promote. So they've got a laboratory on there for infertility. They've also got ideas of teaching family planning. So how they wanted it to be taught at universities and in different sort of workshops. They wanted to also look at how contraceptives were being tested. They wanted to also have a look and develop a mail order service. and they were promoting their work, the Family Planning Journal, so they could promote their work. This is actually from 1964. But actually, as I've discovered in my research, a lot of these things were actually happening pre the end of the Second World War until the period that I'm studying. So I just wanted to draw your attention to that though it's being promoted in the 60s, a lot of this was actually happening before, and is another one of the key reasons why I'm interested in my time period. So as I showed you, the promotion of the Family Planning Association in 1964 discusses a laboratory for infertility in London. This actually opened in 1944, so 20 years before that, before the promotion in 1964. And Caroline Rosterholz, who's another one of the key people I'm researching in my thesis, in her book Women's Medicine, emphasises the work of the Exeter Clinic in supporting patients and promoting a conference on the topic, which became an annual event. So people at Exeter were really promoting work on infertility, and this actually became an annual event for the Family Planning Association. And this was actually testing both husbands and wives in infertility. So just to give you a little bit of context about why this was important, numerous scholars, for instance, Claire Langhamer, have emphasised the increased importance of motherhood in the post-war period. And this was really a response to the perceived disruption of the Second World War. So obviously you had a lot of people dying in the Second World War, and there was a real concern about the number of people being born. So the Family Planning Association are really trying to promote their work and say that they can actually offer support in this. Okay, so as I mentioned at the beginning of the presentation, but also when I mentioned Exeter, I'm going to talk about a case study of Dr. Margaret Jackson. Dr. Margaret Jackson was the wife of a local GP, and she helped found the first birth control clinic in the southwest Exeter in 1930. And when patients started to come because of concerns regarding infertility, she became influential in this area as well. And what I'm going to show is a lot of her ideas were taken up by the Family Planning Association through her work in kind of conferences, but also this work was also taken up locally in Birmingham and Winchester. So what research did she do at Exeter? So she helped found the conference on infertility in September 1948, which is one of the things I look at in my thesis. This was held at the University of College in the Southwest, University of Exeter. The conference series was started in Exeter in 1944, which when I looked at Caroline Rosterholz, I mentioned that. So you can see within less than 5 years, they've got another conference happening in Exeter. And this was organised by Dr. Margaret Jackson, who by this point, by 1948, has become a medical officer to Exeter Family Planning Clinic. So she's become a medical officer for the clinic. And it was a really prominent conference as it focused on male and female infertility. As I mentioned, this was a key part of their work, and they really promoted it at the conference. Margaret Jackson presented 2 papers, one on vitamin E and one on basal temperature charts. And she really challenged research in 1944 that vitamin E helped male infertility. So she was challenging quite current research at that time, that in 1944 they said it actually helped male infertility, and she claimed it absolutely didn't. So you can see that she's challenging quite current research at that time. She also revealed why temperature charts didn't work, and this included also practical issues such as the patient not being able to shake the thermometer down properly, not going to the doctor, not explaining some of the problems. And her research was also used by other researchers. So I'm going to go on to that now. So her research was also taken up in Birmingham. So A.C. Cook, who was based at the Queen Elizabeth Hospital, which is directly opposite the University of Birmingham, and Anita M. Mandel, who was based at the medical school at University of Birmingham. They both reference Margaret Jackson's work on infertility, and also Claire Harvey, who was her colleague's research. So you can see there that their work's being referenced. So they reference their work in research articles. But it wasn't just in the academic community that Margaret Jackson's ideas were taken up. It was also locally in the Birmingham and Winchester clinics. So just to give you a little bit of an overview of family planning in Birmingham, just so you can see the changes. So the Birmingham Women's Welfare Centre, which was the clinic, opened in 1927. So you can see that's obviously in the interwar period. And women came for a variety of support. This included contraception. So when I showed you the pamphlet for 1964 and it mentioned a mail order service, this was actually established in Birmingham in 1938. This meant that you didn't always have to go to the clinic to gain contraception. If you'd gone before, you could actually order it through the mail order service. This helped people to gain, obviously, support. And infertility advice was being promoted as early as 1930. So that's really early to actually be encouraging that. And this was partly due, as I found in my thesis, due to the support from the University of Birmingham. So as I'll show you in a minute, a lot of the members of the Birmingham Clinic had husbands, for instance, that worked at the university, or they themselves worked at the university. And the fact that there was a medical school there that was really promoting their work really aided their development. So, and in this, as I mentioned, the importance of University of Birmingham, I'm really influenced by Ruth Watts's book, Women in Science. And Ruth Watts stated that the progressive administration policy at the University of Birmingham offered women greater opportunities in medicine than even London. So it's those opportunities that really helped them. And this enabled a network of middle-class women in Birmingham who promoted educational prospects for women in medicine. And it wasn't just that, it also helped the Birmingham Clinic because you've got women training at the medical school, and a lot of the women actually came then to work for the Birmingham Clinic. So they're gaining quite a lot of support. As I mentioned, a lot of the people also had husbands or worked at the university. So they networked quite a lot with the university, as I found in my thesis, and this really helped for their development. One such person was Hilda Lloyd. So I'm just going to use her as an example. She's one of the women that I look at, one of the prominent women in my thesis. She studied at the University of Birmingham in medicine, and then she became a lecturer at the university in 1946. Alongside that, she became president of the Birmingham Clinic, and when she retired and left Birmingham in 1959, she retained those connections with the Birmingham Clinic and became vice president of the clinic. So she really kind of kept working for them. Alongside that, when she retired, she moved to Herefordshire, so not too far. It's about sort of half an hour, 40 minutes away from Birmingham. And it was said that she helped develop a family planning in Herefordshire during that period. So previously they hadn't had a lot of support there, but she developed evening classes and seminar sort of sessions and really helped develop family planning in that area as well. But she's got a lot of credentials. As I mentioned here, she's the first female chancellor of British University, which was the University of Leeds. But I think what I found really interesting is that her links with the University of Birmingham, because of obviously being a lecturer, but how she used that to kind of help the Birmingham Clinic. So in 1953, Dr. Margaret Jackson, through her research in infertility, supported every clinic promoting infertility and thought every local family planning clinic should support this. And this could be done through the use of a speculum, and a speculum we associate now with a smear test, but they were trying to promote this to actually understand more some of the gynecological ailments. In Birmingham, speculums had already been bought and being encouraged by this point, and they were actually supported in this by Hilda Lloyd. So when they actually, when the Family Planning Association asked them and wrote to them asking them to buy speculums, they'd got Hilda Lloyd that would come to their meetings and suggested where they get the speculums from, what sort of area they needed, that sort of thing. And she offered quite a lot of support. And I think it really shows the importance of the medical school to the development of the Birmingham Clinic. So they could actually become a training centre, which meant that university students as well as doctors and nurses could actually learn about contraception because they got this support. As I hinted there were problems with Birmingham. So there were air raids during World War II. And certainly when I start my research in 1945, the accommodation is really poor. But because of their links with the University of Birmingham and the medical school, for the first few months of 1945, they actually found accommodation. So they were able to kind of carry on, which I think is really important. And it's a really good comparison to Winchester. So what support was available in Winchester? So again, like Birmingham, I've given an overview of the type of family planning that was available. So it was established in 1933, so not long after Birmingham, which was 1927. It offered support, but it was in a more like a rural location and a lot smaller, so that hindered the type of support. And what's really interesting about Winchester is that is actually the like movement of where the clinic was. So what I mean by this is when it was established in 1933, it was based in Winchester. But in like 1940, the building that was used was needed for the like war effort. And they when they offered it, they were told that they'd actually get the accommodation back, but that never happened. So what happened was they believed that from 1940 they were based in Eastleigh. So obviously not far from Winchester, but basically Eastleigh already had a family planning clinic, so they've just merged with Eastleigh. And it wasn't until 1951 that they actually moved back to Winchester. So it's been really interesting for my thesis, sort of charting where they actually were at different times, particularly because my research ends in 1955. But also, I mean, it was a struggle finding out which women worked in Eastleigh, which women were Winchester. That was quite interesting when I first started. But I think it really gives quite a lot of indication about some of the problems that some clinics had, for instance, finding accommodation. And it's only in 1951, it's one person at the clinic that actually got them that support in Winchester. And I'll be talking about that in a minute. Before I do that, another reason which is, I think, quite different about Winchester to Birmingham, obviously it's different geographically. As I mentioned, Birmingham had the medical school. But what I found really interesting about the thesis, and I actually didn't know this until I was researching it, that Winchester was tied to a medical cases only. This meant that only specific groups were allowed family planning. And so I've put a list here of some of the conditions where you could gain family planning. So if you had experience of chest conditions such as TB, patients with diabetes, cases who are late in life and the doctor thinks it's inadvisable to have any family. So obviously you can see it's quite restrictive, the type of people that can access family planning. Also in comparison to Birmingham that ran as a voluntary organisation where generally a lot of the people, if they were like married or engaged later on, could access family planning. These kind of like restrictions made it quite interesting to compare for the thesis. But as I mentioned earlier in the presentation about links to like eugenics, there's also, although it's not sort of direct, it's quite indirect, you have to think about who they're allowing to get family planning and why they're sort of allowing. So there's elements of that I bring up in my thesis as well. Okay. So despite these factors, who could access family planning and the accommodation problems for Winchester, Winchester did promote infertility and also offered support to the unmarried. So in October 1950, there was an event at Winchester Hospital where family planning members gave information on infertility methods. By 1951, there was an increase in infertility cases coming directly to the clinic. Cases sent by the doctor to the Winchester Clinic during 1954 to 55 stated that there were many infertility cases we could help with. So despite the problems that they face, they're still quite determined to try and help in infertility. They also did a lot of work for the unmarried. So in Winchester, the 14th annual report, which is just the annual report of the clinic for 1950, gives the names of Dr. Carden and Sister Cameron. Dr. Carden I'll be coming back to in a minute, but they were both pleased at the increasing numbers of young girls who come for advice before marriage and return as regular patients afterwards. So they're trying to encourage them and they're quite pleased about that as well. In Birmingham, there was more support for the unmarried. So in April 1952, I found a letter from the rector of St George's, which is in Hockley in Birmingham, asking if he could give the name of the clinic, the Birmingham Clinic, to young people about to marry. And he also wanted to mention the Birmingham Family Planning Association in his parish magazine. So you can see that they're getting quite a lot of support, even from the church here, in work for family planning. Birmingham also did quite a lot of support for the specifically for the unmarried. So both in changes that they did at the clinic, but also how they supported other organisations. So in September 1949, it was decided that helpers that worked at the clinic, who were voluntary, didn't need to be married. So previously, they recommended that most people that worked at the clinic were married, and this changed in 1949. Also, as I mentioned, their work with other organisations. So Caroline Westerholt, who's written a new book, it came out last year, A Responsible Pleasure, notes the role of Audrey Court, who is became the chair of the Family Planning Clinic in Birmingham in 1961, and also two members of the University of Birmingham, Dr. Martin Cole and Professor Francois Lafitte, in establishing the Birmingham Book Centre in 1966. And this was specifically focused on unmarried people. Previous to this, and this is something I found in my archival material, you get quite a lot of letters, sometimes quite angry letters, from people that about people that had actually, young girls that had gone to like Woolworths to actually buy a ring so that they could actually gain family planning support, because they were obviously pretending they were engaged. Because of this, they really wanted to focus on support for the unmarried. And as I mentioned, Audrey Court was a member of the Birmingham Clinic, but they also got support from the University of Birmingham. The first book clinic opened in London in 1964. Birmingham came not long after in 66, and then it also developed in Bristol and Edinburgh in 1968. So you can see that other clinics were also developing, other book centres. But I hope that shows the sort of support that the Birmingham Clinic, as well as the University of Birmingham, gave in actually supporting the unmarried. Helen Brooke, who the book clinic was actually named after, worked for the Islington Clinic before becoming chair of the clinic and moving to the Marie Stopes Clinic in London. So, and this is what I found quite a lot, that people that worked at family planning clinics started working for the book as well. So there's quite a lot of crossover about staff, particularly in the 1960s. In the sort of late 60s. So it's quite interesting to see the same names that you've researched coming up. But what I find quite important in terms of like significance is something that both Leslie Hall and Adrian Bingham mentioned. So Adrian Bingham's book, Family Newspapers, but Leslie Hall's book, Sex, Gender and Social Change, which I've put here on the right-hand side. They both stated that the margins of what constitutes acceptable sexuality have changed over time. And this is something that I found throughout my thesis, this idea of, first off, it was just for married people, then it's for engaged people, and then you've got support for unmarried. You've also got quite a lot of changes in, for instance, not just the support they're offering, but also who's allowed to offer the support. So as I mentioned, helpers didn't have to be married. And I think that's what's really important about the time period I'm researching, this sort of change over time in terms of acceptable sexuality. So I mentioned earlier that I'd have a look at Dr. Lucy Carden because she's really key in this idea, both because she supported the unmarried. The annual report for 1950, as I showed you, specifically mentioned Dr. Carden supporting engaged couples. She was the main doctor at the clinic, and she encouraged young girls to gain advice before marriage. In November 1951, Dr. Carden met with Dr. Cronk, who is the Hampshire County medical officer, to gain block grants to support women. So even though there was, as I showed you, there was criteria for who could access family planning, it was even harder than that because there was a financial limitations because it was a voluntary organisation. So Dr. Carden's meeting with Dr. Crump resulted in greater access for women considered to be like medical cases. So it offered them, by gaining block grants, they could, a lot of the financial stress was taken off them. It also provided like new accommodation. So as I mentioned, it moved to Winchester in 1951. This was the like direct result of Dr. Carden, who worked with the Hampshire County medical officer to ensure that they moved back to Winchester. So she was quite a key person that I look at my family planning, and she had a great impact for Winchester in the number of women that could access family planning. There were problems early on because of these financial constraints, as I mentioned, but also providing a new accommodation in Winchester. So just to conclude, I really focused on the significance of studying birth control education during the Second World War and post-war period. I've tried to show that a lot of the changes that were actually happening in the 1960s were actually coming across in the Second World War or just before the Second World War, and really impacted a lot of the post-war period. And also the importance of examining the Family Planning Association as an organisation, seeing how a lot of the ideas that the kind of change of work that was undertaken in the post-war period, I've mentioned like infertility and support for the unmarried, that were taken up both like nationally and locally, but also the challenges. So as I mentioned earlier, it was a voluntary organisation, and there were huge financial constraints, and that's why a lot of the time when I read a lot of the archival material, they have links to very prominent people or the Eugenics Society, as I mentioned earlier, to try and provide this sort of support for people. I've also tried to show the work undertaken by the women at the clinic, whether this be in Winchester. So I previously mentioned on the site Dr. Lucy Carden, but I also mentioned Audrey Court for her work with the unmarried, and also Hilda Lloyd and her work at the university, which really enabled the Birmingham Clinic to actually be a training centre, and they trained doctors and nurses and students and medical students to actually learn about family planning. And just to, I thought I'd just end with this image, because personally, this is a plaque for the University of Birmingham for Dame Hilda Lloyd, and I must have gone past this as a student at University of Birmingham hundreds of times, because I did a medical history as one of my modules, so it was based in the medical centre, and I never noticed it. So there's that aspect to it, which was really interesting, that I sort of studied there and didn't know her impact. But also because though they mention her work with midwives, what I find really interesting is there's no mention of her work in family planning. And even when you read the pamphlet which accompanies the plaque, there's also no mention of her work in family planning, which is really what I'm trying to do in my thesis, trying to, I suppose, show the women's contribution and sort of highlight their work in family planning. And that's something that I found really interesting, particularly because family planning was a controversial topic, particularly in the sort of 1920s period. And so even though that I'm researching the 1940s and 50s, there's still an aspect of it being controversial, which is why I was really interested in the links with the church, for example, and also trying to highlight the women's work in family planning more widely. Thank you. My email address on that. I've also done a list of some of the books that I've, I don't know if the PowerPoint or PUP can send.
We can send it if they requested. It will be in the recording anyway.
Okay,
so they can play the recording.
Oh, that's absolutely fine. It.
Yeah.
But I've mentioned, I've put on here some of the key texts that I looked at, but also I mentioned the research that I've done at the Wellcome Library, which has been the main sort of archive to actually find my research material. But thank you very much. Thank you.
Brilliant, Susan. So we always have questions from the audience. So first of all, I'm going to stop the sharing at this moment. And so let's leave it there. We have, if people at home want to pose a question, just, raise your hand. But otherwise, we'll start with people here in the room. Oh, gosh. Let's start with Chris. Let's start with Chris first. Yes.
Thank you. That was a fascinating talk.
Thank you.
Wow. So thank you. There was a comment you made early on in the talk when you said the Family Planning Association depended on funds from the Eugenics Society, and that created tension.
Yeah.
Can you tell me more about how?
Yeah.
What kind of tensions they were, how they manifested themselves?
It created quite a lot of tensions because, I mean, initially when I first started the project, I have to say that I was always told at university that the relationship with the Eugenics Society ended after World War II because of obviously connections to like Nazi Germany and that sort of work. But it actually continued for quite a long time. So the Family Planning Association and the Eugenics Society actually shared a building in London, and they were really heavily influenced. But a lot of the tensions that and what I was sort of hinting at was that the Eugenics Society offered a lot of like money to the Family Planning Association, but there were like conditions for that, and they wanted a lot of emphasis on eugenics. For instance, when I mentioned their objectives, they particularly wanted objectives connected to like eugenics. And the Family Planning Association didn't want that and thought that particularly because they thought that it might put off people trying to access support. And so I know that a lot of historians such as Leslie Hall have kind of hinted that there was a lot of tensions between the two societies, that the Eugenics Society believed that they were offering so much money that they should have a say in what the objectives of the organisation were. And it really wasn't until I'd say the 1970s when the Family Planning Association became part of the National Health Service. They didn't have to rely on that sort of support, but it did last quite a long time. And it was a case of just two organisations, one trying to function, but the other one asking for a lot more than the other one was willing to give.
Right.
Yes.
So, a very interesting paper. I've got two questions.
Okay.
The first one actually kind of with eugenics. So Mary Stokes' views of eugenics was actually to do with the British Empire and the white race. But it was also because as a middle class woman, she believed the middle class was better equipped to represent the British and the working class. And her views on eugenics was actually the working class was the problem. So it's not just eugenics to do with race and things like that, it's also this idea of the working class needs to be controlled. So when it comes to the 45-55, because you do, I mean, of course, these are brilliant women as researchers, and so, but as you mentioned yourself, they're all middle class women. So do they carry on with this idea that the working class need to be controlled when it comes to the planning and therefore the pill, or have they already moved away from that? So that's my first question. And the second question, if you could develop further the religious aspects, because of course, right, coming, as you mentioned yourself, coming out of the Second World War, it's quite surprising was the parish record you mentioned, they were quite welcoming it, because very often they were not very happy with, of course, pre-marriage sex.
Yes.
So can you perhaps explain those two elements?
So certainly the support for that really does come across that a lot of women that I'm researching in my thesis are like middle class women, and there's still an emphasis on trying to control working class infertility. So there has been research that by the time period that I'm researching, that a lot of working class fertility had been sort of controlled, as it were. That actually wasn't the case, and they are specifically a lot of the time trying to target working class people to access family planning. And it's, to be honest, it's quite a two-pronged approach. They're trying to remain respectable and trying to gain this sort of wealthy upper like middle class people to join, but they're also aware that they need to support working class women. So a lot of their work supported is specifically targeted to working class people. So Caroline Rosterholz, who I mentioned, in the 1950s, the IUD that was developed wasn't developed in the 1950s, but it was used in the 1950s specifically for like working class women. It was developed in the 30s because they thought it was quite useful for like middle class women, because it was They didn't think it was too expensive and it was quite easy to use. But by the 1950s, it's been specifically targeted to working class women. And that certainly comes across in my thesis. And also going forward to the 1960s, what I'm looking at the moment, or trying to work on as a research article, is about a eugenic kind of principles. So I look at Spark Brook, which is a particular part of Birmingham, and there's work particularly to target ethnic, like minority groups, and trying to target them for family planning. But there's also a lot of work trying to target working class families as well. So there's that element throughout the thesis, and also after the thesis end date as well. But this idea of the Catholic Church that you brought up, it's quite interesting actually, because there's certainly a lot of opposition to the family planning clinics, particularly in Birmingham, that I've found from the Catholic Church. And there is also some opposition from the Anglican Church, that they don't want to get involved. And that comes across in Winchester, about certain people that they feel will take part in their kind of clinic work and other people that won't. And then you get the case in Birmingham, as I mentioned earlier, that you get a rector that wants to find out, or a Bishop Barnes that was involved in Birmingham actually became a vice president of the Birmingham Clinic. So you get certain people, certain individuals that want to be involved in family planning. But I'd say that as a sort of general a majority, there's a lot of protest to family planning, and also it's also based on like locality, which is what is also interesting about my thesis. So when I mentioned the Brook Clinic, Caroline Rusterholz mentions that there wasn't much opposition to the London Brook Clinic, but in Birmingham there was a huge protest, and a lot of it was religious. So it's really interesting that, and it does depend on the person, but it also depends on the location as well.
Thank you.
Thank you.
So I've got two questions too. So I wonder if in your thesis you're looking a little bit also into the human profile of the two cities, because they are very different,
Yes.
aren't they?
Yeah.
You mentioned the ethnic factor in Birmingham.
Yeah.
I mean, Birmingham is the target of big migration in this period.
Yeah.
Winchester to not a great extent.
No.
At least not international migration.
No.
So how far, are you looking into that? Also the quantity of people. I mean, Birmingham has higher number of people than Winchester. And as you said, Birmingham tends to be in an industrial city, while Winchester tends to be the capital of a county that is many things, but essentially with a rural, hinterland. So how far you're looking into that in your thesis?
I am in quite a large way. It's one of the reasons that I picked the locations. So particularly in the introduction to my thesis, I kind of look at why I've kind of picked these two locations. And it is, as you mentioned, they are so different with the number of people, geographically, aspects of trade, aspects of immigration. And it's sad in a way, because initially when I started the PhD, I hoped that I could look at the type of people that were accessing the clinics. But because obviously it hasn't been 100 years, a lot of those have been, I can't kind of access them. So I had to change how I was doing it and look at the women that were offering the support rather than the people that were accessing it. Because I think if I was able to look at the people accessing it, maybe that's in sort of years down the line, that might be another research project, hopefully, that would give a more of a clear kind of indication of some of the differences between the people sort of accessing support. But even sort of having a look at the people that are working there, there's a huge difference, even with the type of organisations that they work with. So I mentioned the University of Birmingham, but in Birmingham, they work a lot with professional organisations, and in Winchester, they work with a lot of a voluntary sort of organisation. So even the kind of people they're getting, even though they are predominantly middle class, are quite different, and that's one of the key things I found in the thesis, really.
And my second question is, you mentioned that there was a lot of emphasis on fertility.
Yes.
On this perceived impact of the Second World War, and obviously that might have resulted in the baby boom later on. But also, it seems that at least in Winchester, they're placing a lot of emphasis on the girls. Like fertility is a girls' problem.
Yes.
I mean, they don't look into men at all.
There's more emphasis on men at Birmingham, and part of that I think is because of the resources that they've got. I mean, I did find some examples of men that had been able to access support at Winchester, but primarily it's the women, and that's something that I'd like to look at and see why that might be. But I think a lot of it is actually due to the resources that they've got. Also, I think with Birmingham, they did a lot of promotion to try and encourage men to access the clinic. And so from what I've gathered from the research material, that isn't so abundant in Winchester. So that kind of makes quite a good difference between the two.
Well, one wonder why they
yes,
didn't do it.
Exactly, yes.
Yes. Right. Yes. Sorry. Did you?
I love this. Yeah. I'm quite curious. I think there probably was like research earlier, but I think a lot of it is honing in on that sort of concerns about population. And certainly what I've read about the Family Planning Association, they tried to link themselves to those sort of concerns. I think as well, because the Family Planning Association was seen as so controversial, and there was so, I think a lot of the work sort of in the interwar period was trying to actually, from what I've read, was trying to establish family planning clinics. So they had so many problems in establishing them. So as I mentioned, there was a lot of a religious opposition, for example, to them opening them. I think because of that, there was only so many elements that they could get involved with. But I do think there probably was sort of infertility work. But I think just after the Second World War, they had this opportunity to kind of further develop it.
Because I think it's interesting that the change of wording.
Yes. Yeah.
Very, very different concepts.
Yeah, exactly. Yeah.
Mm-hmm. Yes, Javier. Sorry, no. Richard first.
First, I suppose it's more of an observation than a question, but I think Keith Joseph didn't think Mary Stopes had succeeded with her eugenic approach, because I remember in the early 70s he caused a big stir by saying that social groups D and E were breeding too much, and social groups A and B weren't.
Mm-hmm.
That's an observation. The view continued. I was wondering, was there a sexual health element to the work? And Chris may be able to make a contribution. There was a lady who did a PhD on sexual diseases. Andrea something, was it?
Oh, yes, yeah. Andrea
I
Harris. Yeah.
can't remember the second one. That was
Yeah,
one more.
familiar with diseases amongst the British military, yeah. Very got a good memory. Yeah.
So that there was a lot of research into sexual health, particularly during the Second War. So that a lot of the research material that I find, particularly in Winchester, was a lot of trying to particularly sexual diseases. But when I first started doing the research project, I went to Southampton archives. And there's a lot of research there on people obviously kind of coming back with sexual illnesses. And that does link into Winchester. So you do get a couple of occurrences.
And of course, Winchester.
Yes.
Garrison.
Yeah, exactly. So you do get a few instances, but you get a lot more. I remember going to the Southampton archives when I first started the PhD, that there was a lot for Southampton, and perhaps that could be initially when I was thinking, I thought, oh, is there like enough research material to warrant a comparison between Birmingham and Winchester? And so I went to Southampton to see what was available. And I certainly found there was a lot more in Southampton, but there, as I said, there were some cases that I did find for Winchester.
Yes, Javier, yes.
What about the localities and space? So these clinics, where are they in Birmingham and Winchester? And depending where they are, was it very obvious for these young people or people, you know, girls and boys that going there? Is there a way? I'm thinking about, like, as you said, about the social stereotypes.
Yes,
like
exactly.
Like,
That's a really good question.
Is it really in the centre? Is it in the hospitals? Well,
so the Birmingham clinic was actually, there was a lot of tension between the different family planning members, but it was near the University of Birmingham because there was all those resources available. But there was a lot of tension because of that. So Audrey Court, who I mentioned in the presentation, accepted that the clinic should be near the university, but she wanted smaller clinics to be available in different parts of the city and to be more viable, I suppose, for different members of society. And Leah Secker-Florence, who was the chair at that time, was absolutely against it and wanted she wanted to really promote this idea of a middle class accessibility through the University of Birmingham. And actually one of the archival material that I found was actually Audrey Court trying to develop clinics and actually saying, look, I'm not going to actually discuss this with Leah Secker-Florence until it's actually been opened or due to open, so that it can't be stopped. So there was that tension about where the actual family planning clinics should be. And that was one of the things about the book clinic. So Caroline, like Rusterholtz in her book, there's a whole chapter on how the clinic should look and how it should be inside to help young people to want to come. So she even mentions, like, so, you know, how the sort of tables should be laid out, the kind of like lighting, the kind of like magazines, that sort of thing, to try and gain people to kind of gain like a new audience, as it were. The Winchester Clinic was part, as I mentioned, was part of Eastleigh. And so it was, you get a lot of people going to Eastleigh. When it moved to Winchester, it was part of the medical offices. So again, that was quite hard for people to access. And unlike Birmingham, it was only open on certain days of the week. And that extended during the time period that I'm researching. But I think that also contributed to the number of people that were actually able to access. And if I had sort of a longer sort of time period, what I'd like to do is sort of chart whether, because I know that the family planning clinic moved again in the late 1950s, so I'd quite like to chart where that was as part of the research project.
Yeah, sorry, just I think that's fascinating.
Yeah.
Birmingham University, if I'm correct,
Yeah.
very central.
No.
Actually, you can go there without being too much noticed.
Yes.
Whereas, of course, which is much smaller, and especially if it's a place, of course,
Yeah.
you're worried about the neighbours, you're worried about
yes.
you in the city, and actually that can have an impact at that time on the
Well,
streaming.
certainly. So where it's actually based, University of Birmingham, is quite like a leafy, and so it's based in sort of Edgbaston. So it's very like a middle class, so it attracted certain sort of clients, and that's what Audrey Court was concerned about. That there's certain people that are just like will not come to the clinic, and that's why she wanted to establish clinics, for instance, in different parts of Birmingham, sort of clinics in sort of like Coventry, which is about 40 miles away. So they weren't all coming to Birmingham, because obviously you've got that problem where they're a voluntary organisation, they're paying for all these people. There's only so many people that are going to be able to access support. So you've got that. And yeah, in Winchester, you do get a case that certain people don't know about the unit, don't know about the family planning clinic. So I've got a case where there's actually he was a lecturer at the University of Winchester that slowly gets involved in family planning towards the end of my thesis, and he lives actually near the chair of the Winchester family planning clinic, but didn't actually know that that she actually worked in family planning at all. He had to go through what was called an area like manager, who's kind of in charge of different parts of the country in family planning. Had to actually go there. He tried to get involved in family support, I think in Bournemouth, and then person told him, oh, there is a Winchester clinic and this is the person, and then he didn't realize that this person actually lived, I think, about two doors away from him. So there is that aspect, but also it's because it was still seen as quite controversial. So I did find like a letter of Winchester where they said, oh, there's certain groups that don't want to be involved with us, such as she called it like the Winchester the cathedral set and the religious groups, and also the Winchester College group, and she listed all these groups that she didn't think would work with them. And I was sitting there going, that's quite a lot of Winchester when you really like read it. So you can't advertise in any of the papers, you can't openly talk about it, you can't, there's so many groups that you can't go to. So there does end up a kind of, oh, I know this person and I've worked with her in an organisation. She's talked about family planning, so I'm going to join, and that's how they kind of have to recruit, as it were. But yeah, there's still that aspect to it in the period I'm researching. Richard, yes.
Does the setting up originally in Eastleigh reflect a sort of middle class outreach to a working class place?
I think so. I think there's definitely that sort of aspect to it. When I've looked at the annual reports, there's a real emphasis of helping sort of working class families. I mean, I think initially it was just because the war effort like needed the building, and it was like, well, Eastleigh's not that far. You could get there. But certainly when you read some of the annual reports, you do get this sort of emphasis that they're trying to target some sort of like working class families through their work.
I wonder if you can tell us a little more about your sources, because you mentioned obviously Material and Wellcome Library, and I can see that you have been looking beyond that. But you're covering the period 1945, 1955, and I wonder if there may be still people alive who actually use these services, who you probably could be reaching. I mean, have you engaged in any oral history?
I did initially think of it, and because I knew when I decided I was going to have a look at people that worked the family planning, but I think I found that the last person that was involved in the family planning, who was in Birmingham, which was like the youngest person, actually died in 2015. But one of the things I did think and maybe thought about, maybe not for the PhD thesis, but later on, was actually contacting family members, because I found that quite a lot of the archival material that I've used has been from collections of people that have donated material, particularly in the like Winchester like record office, which I was there today. I was looking up the Winchester Towns a Women's Guild, and there was a few talks by Hilda Gurney Dixon, who was the chair of the Winchester Family Planning, and it was quite frustrating because it didn't actually mention what she was actually talking about. I couldn't find anything, but I thought, well, at least there's that connection. But when I looked up, all the research material was like donated by like family members, so that might be something that I look at, because a lot of the research material I've used has either been research collections at the Wellcome, so for the Family Planning Association, but I have also used obituaries, like newspapers. I've looked at a family history, so I've looked online at family history resources, and then I've used smaller like research archives and stuff donated by families. So that's kind of what I've focused on. But I think if I was going to extend that perhaps into after the PhD, like a book or a different sort of article, I would sort of look at family documents and things like that.
Right. And you mentioned that at least in Winchester, they didn't want, or they couldn't, and that's the big difference, to publicize their services in the local press.
Yeah.
I wonder if there might have been some echo in the local press about their activities, even not mentioning the service, but talking about the issues of fertility, infertility, perhaps abortion or things like that may reflect their activities in some way.
Yeah, so that was actually one of the things that's very there's a lot of differences between Birmingham and Winchester, but the one thing that came across in both locations was this fear of promoting in the press. And so they did rely, as I said, in finding like family members or members of, a lot of the time it's members of the same family actually working there, which is quite interesting. So you get grandfather, daughter or son, and then their children working. So it's quite nice that you got, oh, that person again. That's quite nice. But yeah, it was like a fear, and certainly something I came across. I think I probably would come across in Birmingham, but I really came across in Winchester was this fear. One of the women that I look at, she was really concerned when they mentioned, they were mentioning as somebody that could a volunteer. So the area like manager had found someone that could volunteer. And one of the women I look at, Mary Cook, was really concerned that this person came from her like location. She came from her, she didn't live in Winchester. She lived in a little sort of town outside. And she was like, oh, if she volunteers, she'll know I'm in family planning. And so she actually stopped her from actually volunteering at the clinic. So you've got all those different angles as well. And you read it and you're like, but you really need somebody. Each person is doing about 3 people's jobs. But there's obviously that element where they didn't want people to know about their work. So, yeah.
Fascinating. Yes, I think I need something else.
I was particularly interested in 55 because I didn't want to go past, I slightly go past the sort of austerity period. I didn't want to go too far. Plus I had research. So for my BA and MA, I did a lot of research on the from 1960 to 1980. So I really wanted to research an earlier period, but also I picked 1955 because Alea Secker Florence wrote a lot of books on family. Well, she wrote 2 books on family planning, and her book came out around that time. So I knew I wanted to include that because her research was on why people didn't come back to the clinic. So she's looking at patients like returning to the clinic and why they might not return. And she was really looking at the effectiveness also of contraception that they were offering. And from some of those discussions, you get the ideas of the pill actually coming in. So I knew I wanted to include that as a kind of why this kind of period was important. I think it gave a really good kind of overview of the support, but I knew I didn't want to go so much further on. And it might be something that I do kind of later on, because obviously I don't look at sort of past 19, so it might be quite interesting to perhaps do an article from 55 to 60, for example, to kind of look at the differences. But I kind of knew I wanted to end there because I wanted to include her work.
Yes,
it's a final one really. I was struck by that comment you made about that blue plaque.
Yes, yeah. So
she was an obstetrician.
Yeah.
She's done a lot of work
Yeah.
in family planning, but none of it
Yeah.
acknowledged. And a lot of what you've been saying is that family planning was a sort of, you know, a subject to be kind of
yes, yeah, very
ignored
much. You hit very much so.
and not discussed. When do you think that family planning becomes a worthy, respectable?
I think you get some changes. I think it starts to change a little bit in the period I'm in, particularly because the work they're doing. So they're trying to work with different organisations. But I certainly think the real change was when they became part of the National Health Service. And it did take a very long time. In fact, Audrey Court's book that I referenced, she actually looks at why actually it took so long. And it's all those concerns that you mentioned. Obviously, it's a financial, but also there's concerns about whether family planning warrants that kind of support, particularly from the government. So some of the things I look at, which is just past my period, but I did do a little bit of research. There used to be some a charitable like donations you could get from I think it was from the Cinema Trust. It was linked to the idea of like a cinema, and you could get like donations, and they actually they went through the whole process of applying for it. It was about 1957, 58. And I was reading a parliamentary discussions about it. And a lot of the people were like, why should they gain sort of like a donations, and because we don't particularly like what they're trying to do, and I'm thinking, well, they are like a voluntary organisation. How else are they going to gain? It's a fund for voluntary organisations, and yet they're actually being in Parliament, they're actually saying that no, we don't want to offer it, and they try several times, and then I think eventually they sort of gave up, really. But yeah, there is still that concern that it's still too controversial to kind of
fund. It's perceived to be professionalised when it's absorbed by the National Health Service.
I think certainly it was. I think it was seen as because it was linked to the National Health Service, and you didn't have to. I know. Family members that I chatted to were trying to gain family planning support even in the early, I think 1971, 72. And even then, the family member called up and asked about family planning support. And, it was very hush hush, you have to go through here. And, it was off the beaten track where the support was. And so I think when they sort of joined the National Health Service, that was a kind of stamp of kind of almost like approval that they'd got that kind of support.
No, that's it. That's it. So thank you so much, Susan. It was really fascinating, and we'll have more questions in the pub in a moment.
Thank you.
So thank you very much.